Good morning, students. Myself Sital Patel. Today we will learn about pediatric nursing in that particular topic, integrated management of neonatal and childhood illness. So, first introduction, Imnci, WHO, World Health Organization, and UNICEF, United Nations International Child Emergency Fund, have developed new strategy for management of common childhood illness. It may be a acute respiratory infection, diarrhea, or worm infestations, right? All that management of all that common childhood illness. Then an integrated manner which are responsible for main causes of morbidity and mortality among children. Obviously, if they don't get enough treatment among common childhood illness, so it can create the increased rate of morbidity and mortality among children. So IMNCI particularly focus on all that common childhood illness. Objective to reduce the under 5 morbidity and mortality, disability, and death rate in the developing countries like India by improved performance of health workers. Obviously, become give proper training to the health workers and proper planning and implementation of that particular program, we should reduce the under 5 morbidity and mortality in developing countries. There are three components under IMNCI. First one, improvement of case management skills, okay, of healthcare work providers. All that healthcare providers, it may be Anganwadi worker, ASHA worker, doctors, or community health nurse, whatever. We should improve the case management skills of all that workers, okay, by providing them training and education. Then second one, provision of essential drug supplies. All that basic drugs, right? About related to the common childhood illness. So we should provide that essential drug supplies to among children. Then optimization of family and community practices in relation to child health, mainly care seeking behavior. Obviously, we should provide the health talk among family members as well as particular community where we perform the our procedures. We should give them health talk related proper care, proper newborn care, performing adequate personal hygiene care, all that topics related health talk we should give them. So by this way they should improve their practices, right? Improve their work also. By this way they can reduce the infant mortality and morbidity. IMNCI approach emphasized on both preventive and curative health services, which include vaccination. Obviously immunization is must among childhood. Second one, breastfeeding. uh, in that breastfeeding we should include the breastfeeding techniques, advantages of breastfeeding. Then exclusive breastfeeding is required up to the 6 month, no any drink water or anything. Then complementary feeding, in that which foods are involved, how principles of complementary feeding, all that education we should provide it. Then micronutrient and vitamin A supplementation. Then counseling on health problems, particular health problems. Then lastly, the case management of acute respiratory infection, how we should manage the ARI, diarrhea, worm infestations, malnutrition, measles, and malaria. Okay, all these common illness, common childhood illness, we should give them proper treatment. It also includes home based and community based interventions for improvement of nutritional status. Both in home based as well as community based criteria, both are involved to improve the nutritional status of children as well as appropriate care seeking behavior with treatment compliance. Treatment compliance is most necessary among children. Healthcare providers practice the case management skills through provisions of locally adapted guidelines and training activities to promote their use. Obviously, they practice the case management skills which involve first assessment. Whenever the baby comes with any health problem, we should assess the baby first. Then, according to the assessment, according to the chief complaints of baby, we should plan, and whatever we plan we should implement that properly, and then lastly we evaluate that procedure, right? That baby become recover or not. Okay, by this way we should practice the case management skills according to the guidelines and training activities. The Indian version of IMNCI has been renamed, IMCI is renamed as IMNCI, right? Integrated Management of Childhood Illness is renamed as Integrated Management of Neonatal and Childhood Illness, as it includes the first 7 days of age in the program. Means neonatal period are also involved in this program. It is the central pillar of child health interventions under RCH second strategy. Under the involvement of RCH second strategy, this program is established. The case management process is presented on two different sets of charts. It involves the two different sets, two different chapters or two different categories, whatever you want to say. The first one involved is the for children aged 2 months to the 5 years, from infant to the preschoolers, right? In other words, we can say second one involves the for infant up to the 2 months of age, neonatal period. These two categories involved in case management process. Presently, emphasis is placed on FIMNCI strategy. IMNCI is the integration of facility-based care package with IMNCI package for the improvement of quality of management of newborn and childhood illness. Obviously, when the times goes, there are new advanced technology are introduced. So we should further amended IMNCI as a facility-based IMNCI for improvement of quality of management of newborn and childhood illness at the community level as well as the facility level, especially in low resource setting, underprivileged area, right? Mostly we focused on underprivileged area to provide care to the children.